Welcome to Plano Orthopedic and Sports Medicine, a full-service medical facility established in 1977, specializing in the evaluation and treatment of orthopedic injuries. The medical group is led by 9 orthopedic specialists and a physical medicine and rehabilitation physician. In addition, Plano Orthopedic and Sports Medicine has a support staff of over 75 professionals. At Plano Orthopedic and Sports Medicine, a wide range of services are offered to patients of all ages for specialized care related to problems of the musculoskeletal system. While many conditions are successfully treated without surgery, we do provide a full range of surgical expertise and work closely with the patient throughout the treatment. Each of our orthopedic surgeons is fellowship trained with extensive experience with his subspecialties, which include the knee, shoulder, foot, ankle, hand, wrist, elbow, neck, and back. We invite you to visit our website, www.posmc.com, for more detailed information on Plano Orthopedic and our resources. And now let us introduce you to the doctors you will meet here at Plano Orthopedic and Sports Medicine. Dr. Alan Sutker is the senior partner at Plano Orthopedic and Sports Medicine and has been practicing in Plano since 1980. Dr. Sutker's area of expertise is in the treatment of athletes and their injuries, concentrating on the knee and shoulder. Dr. Sutker completed his residency at Michael Reese Hospital in Chicago. Afterwards, he completed a 1-year fellowship in sports medicine at Long Beach, California, and Atlanta, Georgia. Dr. Alan Barber is a board-certified orthopedic surgeon and fellowship-trained in arthroscopic surgery of the knee and shoulder. Dr. Barber completed his medical degree at Baylor College of Medicine and orthopedic training at the Tripler Army Medical Center. He subsequently established a practice in Plano in 1983, focusing on knee and shoulder problems and how to treat them arthroscopically. He has published numerous articles on the knee, shoulder, and sports medicine injuries and served as an associate editor of the Arthroscopy Journal. Dr. Barber is a frequent lecturer to physician colleagues nationally and around the world, an assistant clinical professor of orthopedic surgery at UT Southwestern Medical Center, Dallas, and a master's shoulder and knee arthroscopy instructor at the Orthopedic Learning Center in Chicago. Dr. Purcell Smith is a board-certified surgeon and specializes in hand surgery. He has been practicing in Plano with Plano Orthopedic and Sports Medicine Center since 1987. Born in Alaska, growing up in Arkansas, Dr. Smith came to Texas to complete his undergraduate studies, graduating in 1977 from Austin College in Sherman, Texas. Dr. Smith received his medical degree in 1981 from the University of Arkansas and then pursued further training in hand surgery through a fellowship at the University of Florida. Dr. Smith has been practicing in Plano since 1987. Dr. Earl Lund is a board-certified hand surgeon and specialist in upper extremity surgical conditions. Dr. Lund is a proud Aggie and graduated from the University of Texas at Galveston Medical School with an orthopedic residency in Fort Worth, Texas. In 1990, Dr. Lund completed additional training in hand surgery through a fellowship in Los Angeles, California. Following this fellowship training, Dr. Lund returned to Texas and joined Plano Orthopedic and Sports Medicine Center and has been practicing in Plano since 1991. Dr. Randall Troop is a board-certified orthopedic surgeon with fellowship training in sports medicine and arthroscopic surgery of the knee and shoulder. Dr. Troop completed a sports medicine fellowship in San Diego, California, with the Oasis Sports Medicine Group. While in San Diego, Dr. Troop worked with several professional athletic teams, including the San Diego Chargers and the San Diego Sockers. Currently, Dr. Troop is the head team physician for the Frisco Rough Riders, the AA affiliate for the Texas Rangers Baseball Club. As a sports medicine specialist, Dr. Troop strives to get injured athletes back to their sports as quickly and as safely as possible. Dr. Steve Courtney is board-certified and fellowship-trained in reconstructive surgery of the neck and back. Dr. Courtney limits his practice exclusively to spinal surgery and has been practicing in Plano since 1995. On the flip side, Dr. Courtney enjoys racing and riding mountain bikes. In addition, Dr. Courtney loves cooking Louisiana Cajun food. After numerous years of trying different boils, he has mastered and perfected the world-famous Courtney crawfish, a recipe of which, along with many other Cajun recipes, can be found on the Plano Orthopedic and Sports Medicine Center website. Dr. John Kraetz is board certified by the American Board of Orthopedic Surgeons and fellowship trained in the reconstruction of the foot and ankle. Dr. Kraetz is also a fellow of the American Academy of Orthopedic Surgeons, as well as the American Orthopedic Foot and Ankle Society. Dr. Kraetz has been in private practice at Plano Orthopedic and Sports Medicine Center for over 6 years and is the founder of the Texas Foot and Ankle Center, located at Plano Orthopedic and Sports Medicine Center. Dr. Kenneth Dauber is a board-certified specialist in physical medicine and rehabilitation. As a physiatrist, Dr. Dauber specializes in the diagnosis and treatment of numerous musculoskeletal and neurological disorders. Dr. Dauber grew up in Houston, Texas, and spent 4 years at the University of Texas at Austin as an undergraduate, then attended Upstate Medical Center in Syracuse, New York for medical school. Dr. Dauber came to Dallas in 1996 for a 1-year internship in internal medicine at Presbyterian Hospital and spent 3 years at Southwestern Medical School. Dr. Dauber has been with Plano Orthopedic and Sports Medicine Center since 2000. Dr. Carmody is a board-certified orthopedic surgeon, fellowship-trained in spine surgery. He is a member of the prestigious Alpha Omega Alpha Honor Medical Society and has specialized in the treatment of spinal cord disorders since 1996. Dr. Carmody stays at the forefront in the knowledge of all new treatment options and new surgical techniques that may benefit any of his patients. One of the latest developments Dr. Carmody has been involved in is with the treatment of chronic back pain and the artificial disc replacement. Dr. Solomon Heim is one of 2 fellowship-trained foot and ankle surgeons at the Texas Foot and Ankle Center of Plano Orthopedic and Sports Medicine Center. He is a member of the American Academy of Orthopedic Surgeons and the American Orthopedic Foot and Ankle Society. Dr. Heim's practice includes the treatment of general orthopedic ailments, sports injuries, and traumatic orthopedic injuries, as well as comprehensive management of all foot and ankle conditions. Do professional athletes experience injuries similar to the average person?
Not really. Professional athletes, just due to their intensity level, may have a more severe injury at times, but the structures injured are the same. We treat our recreational athletes just like we treat the professionals, and we want to try to give them the same care and the same level of expertise.
Dr. Sutker, can you tell me more about cartilage?
The cartilages are these discs in between the knee joint that serve as a buffer between the 2 bones. They're very important to protect the knee from arthritic type changes. In an athlete who tears their cartilage, it may heal on its own, but it may require either surgical removal or surgical repair.
What is the smallest bone in the body? The stirrup is the smallest bone in the body and is located in the middle ear, close to the hammer and anvil bones. The bones in this area are named for their shapes and are excellent conductors of vibration. I'm here today to be treated for a bunion. Can you tell me more about this condition?
A bunion is a deformity of the big toe. It occurs as a result of muscular imbalances across the big toe joint. Its cause is unknown, but we feel that it's secondary to the types of shoes you wear, your parents, or certain medical or neurologic conditions. Treatment depends on how much pain you're having and how severe the deformity is. There's both non-surgical and surgical treatments. After we examine your foot and get x-rays, we can come up with a treatment that best fits your needs.
Who are some of the people I will meet at POSMC?
We have a wonderful team of professionals to assist in your initial evaluation and your ongoing care. At the time of your initial evaluation, they'll interview you, we may get x-rays, and we'll establish what your problem is and what we feel like needs to be done for your care. At some point you may meet Dr. Earl Lund, who's the other hand surgeon. Our ultimate goal is to expedite your care, facilitate your care, and make it be a pleasant experience and get you back on the road to recovery.
Dr. Kraetz, how will you know if my injury is a sprain?
In general, most athletic injuries to the ankle are sprains. In fact, it's the most common athletic injury to the foot and ankle area. Typically, you'll hear a pop or feel a pop, fairly nauseating pain, may even see stars. You'll get black and blue pretty immediately along with swelling, at which point it's very important to do what we call RICE, which is rest, ice, compression, elevation, which helps decrease the amount of swelling as well as limit your pain during that initial 24 to 48 hour period. Typically, the injuries are sprains. When there's a fracture involved, there'll be soreness on both sides of the ankle and along the bone. So if you were to feel on the outside of your ankle and actually feel the bone, and you could either feel crepitation, which is like two pieces of paper scratching against each other, or just have a lot of pain and tenderness there, it could well be a fracture.
Dr. Dauber, can you tell me about an EMG nerve conduction study?
An EMG nerve conduction study test is something that I perform here in the office to determine the source of a patient's problems. Those problems may include carpal tunnel syndrome, a pinched nerve in the elbow, pinched nerve in the neck or leg. This test is often ordered by the orthopedic surgeons or myself to help determine the source of the patient's problems, severity of a patient's problems, or help determine a course of treatment. The test takes anywhere from 30 to 60 minutes, and a patient is made very comfortable during their examination. Usually the results are available that day to the patient, and I'm always happy to discuss the results with the patient.
How can I reduce risk of injury to my spine?
It's very important as life goes by is to become an active individual. If you don't do anything in life, it's going to get worse. And the way to achieve that is by getting a healthy lifestyle, losing weight, cease smoking, get involved in a cardiovascular program, start working out more, and really invest some time in the most important thing that you have, and that's yourself.
Can you name the largest bone in the foot? The calcaneus is the largest bone in the foot, which is also known as the heel bone. A fracture can oftentimes occur in this bone due to overuse or stress. What is the rotator cuff?
The rotator cuff is the muscles that are attached to your shoulder blade. Those muscles go across the shoulder joint and attach to the arm, and they are the ones that allow your arm to raise and rotate in and out. That's why it's called the rotator cuff. Now sometimes these tendons can get damaged. They can be torn, they can wear and tear. You see football players who will tear them, or as you get older there's a tendency for these rotator cuff tendons to deteriorate. Sometimes they tear completely. When that happens, we can go in arthroscopically and using the small puncture wounds, repair those tendons back down to the bone. We do this by using little anchors, which are called suture anchors that have stitches attached to them. And then using arthroscopic techniques, we weave these sutures through the tendon and then tie the knots that hold that tendon back into place.
Can you injure your wrist without knowing it?
You can, and frequently do. I mean, a lot of the patients I see are referred from physicians who are like, well, you know, this patient had a wrist injury, we thought everything got better, now it's starting to hurt again. What's going on? So that our wrist has sort of a backup system. There's some redundancy in the ligaments. So think of it as one ligament will be primary in a certain area, and a couple other ligaments may be secondary. Well, if you just injure the primary one, the secondary ligaments will function for a while. But just like any secondary backup system, it's not really designed to last forever, and then it starts to wear out, and that's when you start to experience the pain.
I have been diagnosed with spinal stenosis. Can you tell me more about this condition?
Spinal stenosis is caused by arthritis in the spine. The nerves run through the spinal canal, and the spinal canal gets narrowed by the arthritic condition. Bone spurs encroach, disc bulge, and they narrow the area for the nerves going through the spinal canal. The treatment for that, as long as there isn't instability, is decompressive procedures such as a laminectomy. You can also treat it temporarily with epidural steroid injections, which can give fairly long-term relief, and frequently we'll try that prior to considering surgery.
Can you name the longest bone in the body? The longest bone in your body is the femur, which extends from the hip to the knee. The femur is the only bone in the upper leg compared to the lower leg, which is comprised of two bones. Dr. Moore, can you tell me more about plantar fasciitis?
Some of the most common injuries and pain in podiatry is heel pain, which is also called plantar fasciitis. It's caused by a plantar fascial band that attaches from the heel bone all the way up into the bottom of the big toe. When a patient steps on a weight-bearing surface, there's a distortion between the forefoot and the rear foot that causes tension of this band of tissue. There's different various treatment plans that we could use to help take some tension off that, and one of them is realignment of the foot.
I tore my ACL playing football. How do you treat this type of injury?
Again, with our sports medicine training, we would be able to take a piece of the tendon from the knee, from usually the front of the knee or the side of the knee, and repair or make a new ACL ligament for you. The ACL ligament, usually when it's torn, cannot be sewn or repaired. So we take a piece of tendon in what's called a reconstruction and make a new ligament for you, passing that back where the old ligament used to be, thereby getting the patient back to a competitive level of play.
Dr. Sutker, can you explain arthritis?
Arthritis is the wearing out of the cartilage on the end of the bone. The cartilage serves as a buffer type of capacity, and when this cartilage wears out, one would have rough bone rubbing on rough bone that causes pain. There's no cure for arthritis, but we have different modalities that we try to control the symptoms, including medication, exercises, injections, and possibly surgical intervention.
What is the difference between a sprain and a strain? A sprain involves a ligament, and a strain involves a muscle or tendon. X-rays, MRI, and CT scans may be used to diagnose a sprain or a strain. Symptoms can include pain or swelling, warmth, bruising or redness, or difficulty using the injured area. Should I be concerned if my child has flat feet?
Flat feet are not always bad. It's one of the types of shapes that foot come in children. If the foot is painless and flexible and the child has no restriction with his activities, then no treatment is necessary. If the child has pain or has a stiff deformity, at times we need to give him some exercises, some shoe modifications, inserts, and maybe even surgery to try to restore painless function to your child's foot.
I injured my big toe and it still hurts. Should I see a doctor?
Yes, indeed you should. And the reason for that is injuries to the great toe, which in this case would be your most common injury, cause significant problems. But there are many things that can happen around the great toe that can be treated without surgery if they're treated on time. But if they're left to be chronic, it turns into a surgical problem.
Do you know how many bones are in the hand? There are 27 bones located in the hand. Fractures of the hand bones account for approximately 1/3 of all hand fractures. How soon after an injury can I return to normal exercise?
We actually encourage people after they've injured themselves in sports to get back to exercising as soon as possible. I actually believe that exercise is an important part of everyone's daily life. Usually with things such as back pain, a good exercise program will help them return to sports in a quicker manner. We encourage all patients to ask questions about what sports they may play so we can return to those things that they enjoy as soon as possible.
Dr. Courtney, how do you diagnose a back problem?
I get a variety of tests, including x-rays, CT scans, MRI scans, and also correlate those diagnostic tests with the patient's complaints. It's extremely important and vital to get a patient's condition correctly the first time, and also for that patient to understand what they have going on with their body.
Can you name the 2 types of bone? The 2 types of bone are cortical and trabecular. Cortical bone mainly consists of protein and acts as a protective covering around the trabecular bone. What is arthroscopy?
Arthroscopic surgery is a minimally invasive technique in which we use a small telescope about the size of a pencil and insert it into the joint in order to be able to look all around inside the joints of the knee and the shoulder to be able to identify the problems and fix them.
What are the benefits of wrist arthroscopy?
Well, in particular, wrist arthroscopy is an excellent diagnostic tool. We can look inside the wrist and find out what's wrong. Peculiarly, a lot of wrist injuries or abnormalities are not really readily apparent on X-rays or MRIs or other diagnostic tests. And you know, if your wrist hurts and we really can't identify the problem, you know, we don't particularly want to make a large incision to look inside when we can use smaller incisions to help diagnose what's really wrong.
What is the patella? The patella is a flat triangular bone situated at the front of the knee and is important functionally because it increases the leverage of the knee joint. Do all herniated discs require surgery?
Well, absolutely not. If you have a herniated disc that's causing a lot of leg pain and weakness, then you'd probably benefit from surgery. But most herniated discs don't cause symptoms for a protracted period of time and can be treated conservatively, non-operatively to a good outcome. What you don't want to do is allow a herniated disc to cause progressive weakness or dysfunction, because it is very fixable from a surgical point of view. But many people, and I would say most people over the course of their time, will have one or more herniated discs that don't bother them enough to entertain the idea of surgery.
Will you explain my condition fully?
One of the most important things is for a patient to understand their spine condition fully. That's so vital in someone's treatment. When you come to the office, I review your x-rays with you, your CT scans, and also your MRI scans. And depending on what you complain about, I correlate that with also the diagnostic test and come up with a treatment plan.
Can you name the 3 bones in the knee? The answer is A, the patella, femur, and tibia. What is the hallux limitus, and how can you treat it non-surgically?
Another common injury is hallux limitus, also referred to as arthritis of the big toe joint. This problem arises due to excessive pronation of the foot and or dysfunction of the big toe joint. Commonly when patients during their stance of gait try to toe off, they have problems functioning at this big toe joint. In order to relieve this problem, orthotics are a viable treatment option. Some common orthotics that I use to treat patients is this sports orthotic right here. It has a very deep heel cup used to help support the heel bone, and also has a very padded and very comforting top cover. And for patients that have big toe problems and injuries, I put a really soft material under here to help cushion the toe as well.
Dr. Troop, how can I injure my rotator cuff?
The rotator cuff is the main tendon in the shoulder, especially used for overhead activities. That can be injured in several ways. The rotator cuff can be injured by falling on the shoulder and causing a tear, or it can be injured by repetitive overhead activities such as golf, baseball, swimming, or even repetitive work type activities. Many times rotator cuff injuries are just due to inflammation, and they can be treated with medication, rest, and physical therapy. If the tendon is torn, however, surgery may be required to get the athlete back to a functional level. With our specialized training in sports medicine, we can now treat rotator cuff injuries with arthroscopy and fix and repair the tendon back to the bone, getting the athlete back more quickly in a more competitive level.
What is the difference between a regular cast and a Gore-Tex cast? In a regular cast, a cotton padding is used underneath fiberglass or plastic. A Gore-Tex cast is a waterproof lining underneath the fiberglass and is primarily used in short arm casts. With a Gore-Tex cast, the patient can bathe, shower, or go swimming without skin damage. I've heard of arthroscopic surgery, but what exactly is an arthroscope?
An arthroscope is a telescope instrument about the size of a pen. We use this arthroscope and insert it into various joints to examine the abnormality. We put it inside a knee joint And with this arthroscope, we can examine the ligaments and the cartilage to decide if they've been torn, and through small incisions, we can correct the injury.
Can you tell me what causes falling arches?
As we age, our foot changes shape, and so our arches can at times fall. Sometimes there is a tendon in the back of the ankle called the posterior tibialis tendon, and that tendon can get weakened either as a result of degeneration, wear and tear, or injury. And your arch can collapse as a result of that. Sometimes surgery is necessary to restore the shape and painless function to your foot.
The term cervical refers to which portion of the back? Cervical refers to the neck region of the back. The discs in this area act as cushions between the bones and allow bending movements of the head and neck. Do you treat just athletic injuries at Plano Orthopedic?
No, not at all. In fact, in my fellowship, in my training, I learned to take care of bunions and hammer toes, hindfoot, forefoot reconstructions, and do quite a bit of this work. My practice does tend to have a lean towards athletic injuries, but by no means am I limiting myself to just athletic problems.
Dr. Dauber, what types of injuries do you treat?
Here at Plano Orthopedics, I see a variety of disorders ranging from sprains and strains of the back, neck, shoulder, arms, and hands. I see numerous other musculoskeletal problems and neurological problems, including carpal tunnel syndrome, radiculopathies, pinched nerves in the legs, arms, or back. I treat patients who have been in motor vehicle collisions as well as patients with work-related injuries.
What exactly is an ESI? ESI stands for epidural steroid injection. Dr. Dauber uses this type of injection to conservatively treat certain types of back pain. How many surgeries do you perform on average each week?
I've been performing surgery here in Plano for about the past 9 years. I operate every other day. Perform about 4 to 6 necks and backs a week. They range from simple microdiscectomies to complex cervical conditions and also complex lumbar revisions. I don't do any unproven techniques. I don't do any investigational studies. I believe the first operation on someone's back is their best one, and that's what I provide my patients.
What types of sutures are used in surgery?
The suture that is used comes in different varieties, and we've been doing a lot of testing, research on the different types of sutures that we use. And there are some that are made out of polyester and different types of materials, some that degrade, biodegrade in time. And generally speaking, we want to have a suture that's at least 40 or 50 pounds tensile strength when you get it looped and tied.
What is the vertebrae? The vertebrae refers to the bones that make up the spine. The vertebrae protects the spinal cord and also supports most of the weight placed upon the spine. Doctors Carmody and Courtney both treat spinal injuries here at Plano Orthopedic. Is the wrist too small for arthroscopic surgery?
Unlike certain joints where it really only takes one incision to look in through, it takes 5 to 7 little small separate incisions around the wrist to actually be able to see everything.
What exactly is a herniated disc?
Most herniated discs don't cause symptoms for a protracted period of time and can be treated conservatively, non-operatively to a good outcome. What you don't want to do is allow a herniated disc to cause progressive weakness or dysfunction, because it is very fixable from a surgical point of view. But many people, and I would say most people over the course of their time, will have one or more herniated discs that don't bother them enough to entertain the idea of surgery, because the body will heal itself in most cases. Surgery is a very effective form of treatment if the pain is severe, it's not responsive to conservative treatment, and you have motor weakness in particular, because that, in that case, surgery actually offers you the best chance for a full recovery. A disc, a lumbar disc, and the discs throughout your spine are the shock absorbers that separate your vertebral bodies. So they're very much like shock absorbers. And what they're made out of is a tough outer annulus, we call it, the annulus fibrosus. And then in the middle, we have this very softer material called the nucleus pulposa. Our disc herniation is actually a tear in the outer annular tough fibers, like the outside of a tire, and the soft stuff in the inside comes out that crack and generally will pinch on a nerve. That's a herniation. If they occur and don't push on a nerve, they generally don't cause leg pain, but they can cause back pain. Most of the time, in fact 90% of the time, they can be treated without an operation.
Do you know the difference between tennis elbow and golfer's elbow? In tennis elbow, pain occurs on the outermost portion of the elbow. In golfer's elbow, pain occurs on the inside portion of the elbow. Drs. Smith, Lund, and Dauber can treat these conditions non-surgically in most cases. Can running cause injuries?
There are tons of anomalies in the foot that can occur with running, starting with shin splints, which is in the shin, or the tibia, but in essence, all the muscles that involve shin splints are making the foot function. So that's one of the ones. Stress fractures, whether it's in the tibia or shin bone or the foot, very common injuries. Nerve compression syndromes, where chronic pounding will hypertrophy muscles in the foot, and then all of a sudden you're squeezing nerves and you get burning nerve pain. Plantar fasciitis, which is a pretty common problem with running. It's chronic heel pain that also occurs in this scenario. And the most important things are to stretch well, to wear good shoes, and when your shoes wear out, replace them. And typically you can avoid these problems.
What methods are available to treat my back pain?
But the idea is to get a firm grasp of what's causing your pain so that we can give you the real options of how to treat the pain and what the chances are of improvement. If we're trying to remove back pain and the back pain is coming from a painful disc, fusion has been our option up until this time, and it does work pretty good. It works probably about 80% of the time in well-selected patients. We're trying to improve the outcomes by considering other novel treatment options such as disc replacement. Disc replacement is a new procedure that might benefit or has potential benefits in maintaining motion and not transferring stress to adjacent normal disc levels, and hopefully will relieve the pain and not cause additional problems to occur over the course of your lifetime. But there are some unknowns involved with it, like is it going to wear out, and if it does, what are the treatment options for that? So there are some unknowns that are still out there, but we may not know for decades. This was a shock absorbing spacer between the bones that in some people becomes diseased and very painful. And if you remove this and replace it with a motion device, motion preserving device such as a disc replacement, hopefully we can remove the pain and maintain the function of the disc and joint. Much like what's been done in the past with knee replacements and hip replacements.
I'm here today to see my doctor's PA. What exactly are a PA's responsibilities? Physician Assistant Certified. Each doctor has a PAC working with him to aid in the patient's care, assist in surgery, and help answer questions. A PA must have a college degree, be accepted into PA school, and attend a College of Medicine for an additional 2-year period. What does a physiatrist do?
Here at Plano Orthopedics, I see a variety of disorders ranging from sprains and strains of the back, neck, shoulder, arms, and hands. I see numerous other musculoskeletal problems and neurological problems, including carpal tunnel syndrome, radiculopathies, pinched nerves in the legs, arms, or back. I treat patients who have been in motor vehicle collisions as well as patients with work-related injuries. When a patient first comes in to see me, the first thing we perform is a detailed physical examination, finding out what's hurting you, where it's hurting you, how long your pain has been present. We'll then perform a comprehensive physical examination to try to determine the source of where your pain is coming from. I may perform x-rays depending on the source of where the problem is, and we'll review any outside records, x-rays, MRI scans to help determine a course of treatment. After we've done that, I'll discuss with you or any family members that may have come with you what my diagnosis is and what the treatment options may be. At that time, I encourage you or your family members to ask questions, but you're obviously welcome to call in if you have questions following that. An EMG nerve conduction study test is something that I perform here in the office to determine the source of a patient's problems. Those problems may include carpal tunnel syndrome, a pinched nerve in the elbow, pinched nerve in the neck or leg. This test is often ordered by the orthopedic surgeons or myself to help determine the source of the patient's problems, severity of a patient's problems, or help determine a course of treatment. The test takes anywhere from 30 to 60 minutes, and a patient is made very comfortable during their examination. Usually the results are available that day to the patient, and I'm always happy to discuss the results with the patient. We actually encourage people after they've injured themselves in sports to get back to exercising as soon as possible. I actually believe that exercise is an important part of everyone's daily life. Usually with things such as back pain, a good exercise program will help them return to sports in a quicker manner. We encourage all patients to ask questions about what sports they may play so we can return to those things that they enjoy as soon as possible.
How soon after arthroscopic surgery can I return to normal activity?
All knee problems can be treated arthroscopically except for total knee replacements. ACL reconstruction is a good example of this kind of procedure. Depending upon the type of graft that's used for that ACL reconstruction, you may have a very rapid return to pivoting sports. After a patella tendon autograft, I have my patients starting to jog straight ahead, half speed at 6 to 8 weeks after surgery. Pivoting sports begin about 12 weeks after surgery, and full contact with a brace starts at 16 weeks after surgery. More information about this can be found on our website in our frequently asked questions section.
What range of problems do you see in your field?
The Lord has blessed me with a great opportunity. I have the privilege of caring for hand patients. That includes hand, wrist, elbow problems. We treat children with congenital problems. We treat trauma, carpal tunnel syndrome, arthritis. What drew me to hand surgery was the spectrum of problems. I get to take care of all types of patients, from small children to elderly, and I just take care of them for a very specific reason. They're upper extremity problems. And it's a great opportunity, and I love what I do.